Ever wondered how to connect with brilliant global minds? Diaspora Scholars TV is here.
Welcome to this episode of Diaspora Scholars TV. I'm at Riverside West in Indianapolis, where we are here. I'm here to meet Dr. Langat, who's here for a program known as the AMPATH Program. He's a Kenyan doctor, and we are here to find out about the program and also about what he's doing here. So I'm walking towards the hotel where he's staying. Yes, Dr.
Yes, Fidelis.
Good to see you.
Yeah, good to see you too.
Happy to see you. I see you are
I'm trying to adapt to this cold weather.
This cold weather.
But at least
but it's warming up. It's not so bad, you know. It's not like the other days when you came.
I came, it was cold. Everywhere here was white.
Was white, was snow.
And I was like, what is this?
when they
I've never seen a snow, so.
The first time it was exciting.
Yeah, it was exciting. The second time, like, hey, the weather is not good. Yeah.
And then after a few days, you got used to it.
After 2 days, I got used to. And then when I met these few Kenyans here, I was happy, like, I'm not alone.
You are not alone. Actually, there are many Kenyans in this town. It just takes time before you get to know them.
Yeah.
But at least now, you are settling in.
Yeah, I'm settling in.
So tell us who you are and a little bit about yourself and about this program. I mean, it's a good hotel.
Yeah, it's quite a good one. So personally, me, I'm called Dr. Langat, Ronald. I'm obstetrician gynecologist resident back at home.
By home, it mean Kenya.
Kenya now, yeah.
Yeah.
So currently, I am in Moitiji Referral Hospital as a registrar there in OBGY department, and that's under Moi University.
Yes.
So my workplace is in Bomet County.
Okay.
And those are my employers who gave me a chance to be in school to pursue my masters.
Okay.
And I'm happy to be here because it's because of Moi University and Global Health and AMPATH.
Yeah, so
that's why we are here.
That's why you are here.
Yes.
We are excited to have you because in the past we have also had many Kenyan doctors coming here to study and for the under the AMPATH program through MTRH.
Yes.
So you know Dr. Sami Liwa?
Yeah, Sami Liwa was here. I'm now the second group after Sami Liwa.
Yes.
They were here. Normally these programs does, I think, Canada, so they alternate every year. So the last year group, they went to Canada. And then this year, we are here. So Iliwa was here.
Yeah.
Between Ross.
Within Ross.
Yeah.
Yeah, we met them here and we had very good moments with them. We were able to interact. And by the way, eventually there's a time when my dad was sick and he went to MTRH. And because of the networks, you know, Dr. Sami Liwa and many others were there to really assist. And that's why we really like to interact with you people when you come. Because
I think networking is key.
Yeah.
And it has become also nice for me. At least for weekends, I'm able to meet you guys and go around and meet other Kenyans. And I think that networking is good.
Okay.
And it's what we also wish because with such an exchange program, you also exchange the software in the mind and you are like, oh, things are done this way as well.
Yeah.
And I think it's our pleasure.
It's our pleasure indeed.
Yeah.
So tell us a little bit about the AMPATH program. So in brief, so how does it run? How did you apply for it? What exactly, how exactly does it work in brief?
Oh, yeah. I think this is a long story in terms of program.
Yeah.
That it goes, I think, beyond that relationship between a country, Kenya first, and
the US.
And then US.
Yeah.
It has been crucial for long. We have had medical schools coming up, and one of them being Moi after Nairobi.
Yeah.
And all that now, it has been an history. Until now, they started these exchange programs between different schools. Now between Moi University, where I'm situated, and Indiana University. this is not only done by postgraduate students, but undergraduate students, they do come here.
Yeah.
And under different programs. And we're happy because this gives us what it gives our students and
a lot of capacity building.
Capacity building.
Yeah.
Because at the end of the road, when they do that, they're not only training their students, but also training for the counties back home. Because at the end of the road, and after 4 years, when we complete the program, we go back and serve at our counties level.
Yeah.
So this program is like, it touches everyone, since it goes down to the level of the county, and that village level where we'll go to serve. So you see, I think it's a wonderful program.
It's a wonderful program.
We wish it can be adapted by, let's say, every training institutions, even because it changed the mind of how we look at things, and in that we'll change our society.
Let's talk about how it changes the mind of how you do, how you look at things.
No, yeah, things are different.
So, how deep? What have you been able to learn, or I mean, what are some of the shockers in terms of?
I think the.
Tell us.
This is a new, I can say this is a new world altogether. Yeah. I had a flight of more than 17 hours to reach here.
Yeah.
Then you reach here like people are sleeping home. You are here daytime.
The time differences.
The time difference is fast. And I was lucky now that I came during. At first I was told winter is over.
Yeah.
Then I came on Sunday. On a Monday, snow falls.
Yeah.
On a Tuesday is already again bright. On a Sunday the following week, I'm told there's a time zone change.
Oh, there's a time, time change.
We lost 1 hour overnight.
Yeah.
So those are good experience. I was lucky. I always got myself lucky in many things. When me being here, it's like luck. Somehow, it's a competitive process, and I don't think I was like the best to be chosen. But somehow I find myself being in the program.
Yeah.
Yeah. So thank God to that. And the other things that we find it different is apart from the time zone, I think the culture, of course, here is also totally different. So it's an open society, man.
It's an open society.
Anything, everything, and people mind their own business.
People mind their own business.
Yeah, no one is. And I think it's a culture difference. And then again, direction is totally different. Because here there is no more bureaucratic hierarchies.
Okay.
You interact with anyone and you are the same.
The same. There is no hierarchical kind of seclusion. Yeah.
They are welcoming people. I can say, although when ask Kenyans, you are welcoming, and I find it so they are welcoming. The other thing is, I think with that time, these guys are time conscious. They say 5, it's 5. You don't come 5 or 2.
It's not the African time. If it's 5, it's 5. Yeah.
So I like that because.
So which hospital are you attached to now, or do you have to go to several hospitals? And also, how long is the program? So give us a view of that.
So it's quite a comprehensive program.
Yeah.
What I can say is it's a 6 weeks program. But in those 6 weeks, it's so compressed. You need to grasp a lot within the 6 weeks for better exposure and learning. So meaning from day one, you already trying anything new, you have to grasp it like it's an opportunity,
like a magnet.
Come like that. So it's a 6 weeks program, and I think since we work under you help. You have several hospitals that we visit. You have the Methodist University Hospital. I was able to interact with very senior colleagues in Uruguay. Able to assist in several procedures that are really nice. Some of the things that we only read in books.
Yeah, you're able to do them live.
Able to see them like, these are what when they mean this. So it was quite an experience in Methodist University. Also, the second week I was in Riley Hospital.
Riley Children's Hospital.
Children's and Mother Hospital, particularly now in maternity, where we were also able to see several cases being done. Then later on, the third week I was in IU Hospital again. and a program now, gynecology, where they do quite
a range of procedures.
Yeah. And funny enough, they are doing robotic surgery.
Robotic surgery.
I've never seen a robot. I will reach after hours.
So there's already AI and robotics in surgery.
AI is doing wonderful job here. So it was quite a good experience. And I'm still in the Sosan Hospital called Eskenazi.
Eskenazi.
Yeah, also practice there. So it's quite a good experience, and I'm so impressed for how all these hospitals work together as one unit, and yet they're able to do their things independently. So it's quite impressive that people can pool resources to a common objective, which is the health of the citizens.
Health of the citizens.
Yeah.
So you see, so essentially you are making rounds in hospitals and rounds in departments.
Yes.
Yeah, so it's a very comprehensive program for sure.
Very comprehensive.
What time does your day start?
Bana, yeah. I thought I was coming for an holiday. So by 5 already you are up.
5 a.m.
5 a.m.
You are on your way to the hospital.
On my way to hospital because it's quite some distance, and I realize these also are driving town. People don't work, so I'm always alone on the street.
Everybody is driving.
Everybody is driving, and so it has become a good experience for me. Mapping out the tall buildings, real buildings are too tall.
Very tall. This hotel is like 12 stories. 12 stories.
And I stay in a 10th story.
You're on the 10th floor.
So you can imagine my journey starts at 10th floor, and I'm only ending up again some distance, and maybe another 10th floor.
Yeah.
So it's
very huge institutions.
Yeah. So by 5:30, already out. 6, they were receiving their reports. As early as 6.
And every person is there.
You reach there, like, because me, I work, they'd excuse me for my lateness because of that walking.
Yeah.
So you reach there like 5 minutes, almost done. The second case.
Wow.
What?
Yeah.
And by 7:30, they're already doing their procedures. They've done their rounds, they're doing their procedures. And now procedures are also scheduled. Time, everyone has their time, their theater, their group. So you only know where you are supposed to be.
And it starts exactly on time.
Exactly on time. Everything has been arranged as per. There's no pull and...
There's no pull and push.
If the case is cancelled, it's communicated very early. And most likely it's patient's request. Not. So that shows you that the terms of time conscious are so efficient and able to deliver efficiently.
To deliver efficiently. Wow. Interesting. So you said you are in Kenya. Which hospital are you based? I know you said you are a student, doing your master's, right?
Yes. So
give us a little bit of your career journey.
As I told you, my career journey has started long. When I say long, it's really long.
Tell us a bit of it.
If we sit down and I tell you about my
story, take a whole day or more.
A whole day. Me being a doctor or in medical field, it has taken some endurance.
A lot.
First, I started my medical school journey 2004. 2004.
It's over 20 years ago.
Over 20 years ago.
Wow.
Being just the other day, and so 04. Some of my classmates are very senior colleagues. Dr. Luga was my classmate.
Oh, really?
Mercy Corrido.
Even Mercy? Luga is now the PS.
Now the PS of ministry. Those are my classmates. So we started 2004 at Moi University. Later on, after like 3 years, me personally, I went there as a private student. And it was quite
my God, that's expensive.
Family. And it was a very hard journey.
Why did you tell us that bit even before you continue? I mean, you decided to choose that path. Looks like you really wanted to become a doctor.
Yeah, it has been my dream, and I we used to read the Ben Carson of this US.
Saying
like, is this real or storybooks? So you could that inquisitive, you want to try new things, and like, no one has ever done so in your family or in your village. You are like, I can try it. And I promised that to Mzee. Mzee was a teacher. He's now retired. He said, no, yeah, you can, why not? I told him, but those fees, man, it's so expensive. Yeah,
I'll do all I can.
If people are there, it means the house are able to. And they did all they were able to. I was able to join first year, second year. Third year was, because now,
that is more university, medical school, yeah.
So after retiring, it was a bit difficult for us stabilizing, and then a colleague of mine who came from Uganda told me, our dean, who was called Provision Chow, has been taken to Uganda to start a new medical school. They are inviting students.
Oh, you saw an opportunity.
Are you able to switch? Told him.
Because you'd end up saving.
How much are they paying? I said, they told me the cost, and it was like half what we are doing.
Okay.
I said, like yesterday, I gave the application form. I ended up in Uganda.
So which city in Uganda? Which university?
I was in Uganda for 6 years now.
Which school was that?
2007 to 2014. It's called Kampala International University.
Oh, okay, KIU.
Yeah. The main campus is in Kampala town. However, the School of Medicine is in Western Uganda, a place called Barara, Shaka, Ushenyi.
I know,
so that's where I graduated from.
I know Mbarara. I used to. I've taken the route all the way through and exited Katuna to Rwanda.
Oh, to Rwanda, it's a good place.
Mbarara is a very good town. Yeah.
Yeah. So that's where I
There's actually many cows in Mbarara area.
Yeah, with long horns.
Long horns. Yeah.
Milk.
Yeah, exactly.
Yeah.
You didn't miss milk then.
I didn't miss because I was like home.
Yeah.
So later on, I graduated.
So that is 2014. Wow.
So you see, it's a long journey. That's like 10 years.
It's a long journey.
It was actually 9 years.
You are not going to give up.
I wasn't. So already I was in the middle of the sea. I have to cross over.
Okay.
Yeah. So.
But I think your past, your few years in Uganda might have been easy academically. You had already gone through the work.
It was struggle. I was just like, this was maybe I was meant to be here. Yeah. Good. So later on, I did my internship in Narok County.
Okay.
At that time, it was Narok County Referral Hospital. Normally do it for 1 year after registration. Then later on, I joined. They'll post you to serve now as a medical officer. So I was posted to Kericho County.
Okay. So now who posts you? Is it the ministry or the county public service commission?
Good. So at that time, that was 2015. The Ministry of Health was still transitioning the Department of Health to counties.
Yeah.
And there was existence of transitional authority at that time. And in fact, we were among the last people to be posted by ministry through transitional authority to counties.
Okay.
Later on, after that, I think counties has been capacity
doing the hiring and
to have their own public service boards. So I was lucky to be posted from national to.
And that meant you were able to remain in the county you would have preferred.
Yes. So I served in Kericho. Kericho was now made me
the real life facing experiences.
Right, from clinical duties to administration.
Yeah.
It was a wonderful experience. Even to be able to do other studies, because I was able to do some managerial courses.
Which ones?
Senior management course, Kenya School of Government.
Okay, in Kabete. Where do you go?
I did from Kenya School of Government, Baringo campus.
Oh, Baringo campus.
That was 2016. So in that now I was able to coordinate my clinical experience with managerial experience, and it was a wonderful experience in Kericho. So I served in Sigawet Sub-County Hospital.
Oh, okay. Sigawet is a big hospital.
Yeah, it's a big hospital.
Yeah,
and I'm happy. I flagged some of the major projects there. They still exist.
Tell us some of them.
At least me being in Sigawet, I had to two hats to wear. First as a sub-county MOH.
Oh, you are the sub-county of...
more than 36 facilities within the in Sigawet sub-county.
What?
As well as
36?
Yeah, there were 36 dispensaries, which were around, I think around 30 there.
Wow,
then
man.
we had health centers like 2, and then we had now the sub-county hospital. So I was also in charge of the sub-county hospital.
Wow.
So at that time, the facility was actually struggling. And I was happy we had someone called Dr. Mutai, who was the chief officer then. They recognized some skills in me and appointed me as sub-county MOH and the Mentorship of Sikawet Hospital.
Wow.
So
you are moving pretty fast. But school took long, but when you got into practice, you are moving very fast.
I met colleagues. Now I was meeting colleagues who were together. We met Dr. Chirchir, Dr. Martin. There are several guys who have been there together. Who are
even probably senior and older than you, but you are now managing them.
They were saying like, hey, is it, you know someone? No. So I don't know, me, I'm a lucky person too.
Yeah.
And me mtu wa kujituma.
Yeah.
So we were able to start 2 new theaters.
In Sigawet?
Sigawet, yeah.
2 new theaters?
2 new. We were able to have a good CSST, X-ray unit functioning. We didn't have even an EMR system to do. We are doing it manually.
Okay.
We were able to do that. Even that EMR, we were able to do even collection in terms of revenue.
Wow.
Things changed, and I saw it growing. It grew until even in terms of human resources, we were able to grow. In terms of, in fact, I was the first case that we were able to do in Sigawet Hospital was not the normal CS that people do. We started with a very major,
complicated case.
And
oh, really?
And it's very successful.
Wow.
So that tells us that we can turn around our resources and make everything works just the way we are seeing it. But it's just a matter of time and fine-tuning a few things here. How we manage our resources, how we manage our time. Simple things, and you can get there.
Looks like time management is something you have learned a lot.
I've learned a lot here. Like, hey,
to the minute.
To the minute, it counts. You're able to account your time.
Starts when it's supposed to and ends when it's supposed to.
Anything beyond there is your time. No one will ask you anything. Good. So that was my experience.
So Sigawet, when did you exit Sigawet? Because that is Kericho County.
Yeah, that was Kericho County.
Yeah. Which year now is this? When and how did you? Why did you have to leave? You were very successful. I mean, how did you leave to go to Bomet?
I think when people realize you are doing good things, they always want to push you out.
Okay.
And you see back home now being the only one in the area and saying you are doing wonderful things in Kericho, but why did you come home? And so everyone wanted to bully me. So I had a lot of approaches in terms of work. And I remember 2018 there. I was able to 2018, 2019. During COVID time there, I'd been posted again to Cap Cadet. But on my way to Cap Cadet, I remember Bomet County approached me that you can come, you can operate from home and going.
That is very enticing.
No, they wanted that. I said, I think that's a good experience.
And being a real keepsake is you are closer to your cows.
I wanted to be close to my cows. Good. So I ended up now in Bomet County. Where I served at Longis County Referral Hospital until 2022, when I had applied for my master's in Moi University. You
still felt like you wanted more?
I wanted more experience. Like, and so I went back to school now. That's 2022. Till now, that's when I benefited from such a wonderful programs. To be new US. I think this is a lifetime experience.
So this is the Maju they talk about.
Hii ni Maju bana. Nilikuwa naambia mtu hapa ni wapi?
So eventually now you get here in the AMPATH program. Yeah. So masters you've done already 3 years.
Done 3 years. This is my last.
This is your last year.
Round. And I think it's quite an engaging and good program that we encourage also people to do something beyond being a general practitioner. It's nice to specialize in an interest because your ambition become and your input will be good.
Input will be good. I wanted to ask you, I know, and it's good you mentioned that because many doctors I've seen in Kenya, they get into practice, they get comfortable, they get engrossed in the cases, they don't want to go for further studies. On that camera, talk to some of our doctors, some of our clinicians, and any other person you can want to know to try and inspire, because in this show, Diaspora Scholars TV, we try to mentor other people who are back home to see that it's possible no matter what. So talk to them.
I think it's all about sacrifice. And there's no need to sacrifice 9 years of your studies as an undergraduate medical school. Then you end up doing everywhere, a lot of work, but when you specialize in a certain area, you give your best to that area, despite years doing the general, but you give your best and you'll be felt. So it's a sacrifice. I know medical school is longer time and it's so hectic, but you can sacrifice one more and you are done. So I encourage my colleagues to come back to school and so that we can give our best to our citizens. It's a sacrifice, but you have to do it.
You have to do it.
You have to do it. There's no other option.
Talk to also the medical students in various schools in Africa, particularly. You know, I mean, doing medicine is hard. It's difficult. It's you use the term lazima ujitume.
Lazima, and happy for those who are aspiring to be medical practitioners. I encourage them that nothing is impossible. Everything is possible. Follow your dreams. Your dreams cannot be hard because it's your dream, so you cannot compare it with something else. So you have to live to it and make it happen. If you want to be a surgeon, go for it. There's nothing hard because just put your mind for the right purpose and you'll reach there. So it's a very fast field and there are several options to choose. Because not only that, surgery can go to medical fields. There are several fields. So it's not only one area. So somehow you'll get an interest in one area. Somehow you'll get, or even several. There's no problem again. So we encourage them to work hard towards your dreams. There's nothing impossible.
There's nothing impossible indeed, and that's why we also go around the US meeting scholars, including the ones who come from Kenya, like Dr. Ronald Langat, a doctor actually based in Longisa, Bomet County, Kenya. He's also a student at Moore University. Through the MTRH and AMPATH program, he's been able to come to the US. We are here in Indianapolis, Indiana. Hapa ni wapi? Mwalimu wa math. Mwalimu wa math. Anafurahi leo. Talk to your family and friends in Kenya. They'll be watching you. Talk to them, inspire them, please.
So I think to my family, I want to say thank you for your support. Right from college throughout this, now we are here. And I know even them they're wondering how I got here, but it's God's grace.
God's grace.
I always say it's God's grace. Kuanga tuna bahati. Nah, that's how my life is.
Bahati na bidii.
Bahati tuna bidii kidogo. Yeah, so I want to say thank you. I know they miss me a lot because this is one of the longest time I have stayed from home. Quite a longer time after 2022. So I do miss them too. And I say very soon narudi nyumbani with a lot of experience and many things that I have seen here. And we hope that will change how we look at things and generally a small society where we are able to, that small circle we are able to influence will always be there to influence. Otherwise, nashukuru.
Nashukuru pia. Thank you so much. My name is Daktari. See us in the next episode where Ronald Langat takes us through some of the hospitals where he's been able to do some of the clinicals and work that he's doing. And again, join us in the next episode.
It's one of the greatest moments. And I can say that that collaboration between Moi University and Indiana University has really gifted us with a lifetime experience. And right here we are in Indiana University, where the Department of Health, where they do the clinical practices under Indiana Health. And this is where I normally pass through when I'm going to the hospital. Every morning? Every morning. Right here we have several hospitals under IU Health. That is, we have Eskenazi Hospital. We have Relay over.
So where we are, so this one right here is...
So this one right here is VA Hospital Center.
Oh, VA, that's Veteran Affairs.
Yeah, it's head of a military hospital.
It's a military hospital, yeah.
Then right next we have Eskenazi.
Okay.
Eskenazi is more of a public hospital. And then next to that we have Riley Hospital again.
That's for children and
mothers.
And mothers, okay.
And then next to that again we have another university hospital, Indiana University Hospital, which also houses Cancer Center, Simon Cancer Center, other departments again built. And then over the other side we have Methodist Hospital, so it's a array of group of
So it's like a medical center with about 5 hospitals.
Yes.
And they're all operating under the
one
IU Health System.
IU Health System, yeah.
Wow.
Right. So
That must have been surprising to you.
Surprising to me because being given these are different facilities and they look like private, public, but they are all under one. So I was imagining if the same can happen in a place like Eldoret is a health hub. City. Kind of, we have several hospitals there within MTRH. I was imagining if we all have one system,
it can save a lot of time.
A lot of time, and even the citizens will be served, because wherever you go, if you want to go to Eldoret Hospital, you'll still find the same doctors. You want to go to St. Luke, you want to go to Medihill, you want to go to Topping. Those are facilities within the same.
St. Luke's.
So if a good collaboration system can happen, it becomes efficient. Yes. And things get standardized. So definitely, and I mean it's a good learning experience for you, for sure. Wow. So you will be taking us to some of those places, but I just wanted to get a feel of some of the maybe procedures or processes or systems that you've seen are like very different, with some example like what you, so that some of our people who are watching can be able to see, oh, that's a bit different. You have already said one. One health system, several hospitals. What about something else? I can say since the training of health is normally universal, I will say that we do different procedures than the rest. However, maybe how we do it.
How you do it, yes.
Is different. And this depends on several factors. Not limited to one technology that we leverage on. Some of the technologies are not within our reach home. The types of equipments they have also different. They have robots. They have never seen a robot. If it's there, maybe I'm not sure. So you see, these are some of the expensive equipment. They are able to access this, and I think if that can happen, it means we are able to do all these things. Because most of the procedures here are also not done. They do laparoscopic, in that they don't open large incisions, just put some spots, and they're able to do
very small incisions.
And they're able to do complex surgeries. So like every surgery here is actually laparoscopic, unless otherwise.
That is
Which now
okay.
is different from home whereby we do laparotomy, maybe open. Unless otherwise for us to go laparoscopic, but also we have challenges of equipment. Sometimes they fail us and it becomes a challenge. But I'm happy, like in our institution where I am, under Moi University, we have had good support from AMPATH.
Yeah.
And laparoscopic has become a growing event. In fact, we had a review of what we have done last year, and we are really doing good in terms of numbers. The procedures we used to do it open nowadays, we are doing it in MTRH laparoscopically. So we have had guidance from partners, especially from IU. Maybe to mention a few names, we had like Dr. Etoro, who came all the way from US to train us there. Dr. Wanju is always there for all the laparoscopy. And they have meant that most of us, and we are happy on that. And also this exposure has exposed us now to the same procedure. So we are happy on that. So those are some of the things that they do it different. I think in terms of supplies of the equipments, the commodities, consumables, here is a bit, they're able to, they have never had of shortage.
They replenish, there's a lot.
Everything else is there. So those are some of the challenges, some of the differences we do there and there. And I like the interaction between different cadres here. Nurses and doctors.
There is synergy.
We cannot tell who is, everyone is doing their own part. And it's a wonderful experience. Yeah.
Excellent. So we'll definitely take your word for it, and for sure I think it's something we want to inspire the people to come. So you'll take us through some of the institutions. We might walk and show us around. I mean,
normally pass by and later on we keep on interacting.
All right, sawa sana. Daktari.
Yeah.
Ever wondered how to connect with brilliant global minds? Diaspora Scholars TV is here.